guys, welcome back to A to Z Dentistry, a channel which features easy explanation of various medical and dental related topics. Our today's topic is Eagle syndrome. So without any further delay, let's get started. Today we will be studying Eagle syndrome under the following headings: Introduction, Definition, Classification, Clinical Features, Radiological Features, Diagnosis and Treatment. Starting with the synonyms for Eagle syndrome. The first synonym is styloid syndrome. Then it is also known as styloid syndrome, elongated styloid process syndrome, styloid cause cervicofacial pain syndrome, carotid artery syndrome. Apart from this, there is also another popular synonym for Eagle syndrome, that is dish syndrome, right? So here D stands for diffuse, for I we have intraosseous, S for skeletal and H for hypertrophy. So diffuse intraosseous skeletal hypertrophy or dish syndrome. Moving on towards introduction. So the styloid process basically originates from the temporal bone, right? So here this is a picture depicting styloid process, right? So it is originating from the temporal bone, right? Here you can appreciate this in this diagram, right? So its normal length is about 1.5 to 5 centimeters in length, right? Here it is about 1.5 to 5 centimeters in length. However, in case of styloid syndrome, as you can appreciate here, the length is very large, right? It is somewhere between 7 to 8 centimeters, right? So this pathological lengthening of the styloid process is basically the main culprit behind the styloid syndrome. Okay, I hope you can make out the difference. Here see the length and here see the length of the styloid process. And naturally, as it is increased in the length, it will definitely impinge upon some vital structures, right, leading to characteristic signs and symptoms. Okay, so see, it is connected to the hyoid bone via the styloid ligament. An elongation of the styloid process leads to impingement or compression of adjacent nerves, right? Then compression of the glossopharyngeal nerve along with possible irritation of nearby structures such as 5th cranial nerve or the 10th cranial nerve is associated with Eagle syndrome, right? So here you can see this is our styloid process, right? So when it is elongated, for example, if it is elongated in this way, here you can see it is directly impinging upon the glossopharyngeal nerve, right? Likewise, it can also irritate the vagus nerve as well. Okay, so the lengthening of this process is associated with irritation or compression of glossopharyngeal nerve, trigeminal nerve or the vagus nerve. Moving on further, let's discuss the definition of Eagle syndrome, right? So basically it is a condition which is caused by elongated styloid process or calcified styloid ligament, which leads to characteristic signs and symptoms such as throat pain, difficulty in swallowing, facial pain or referred pain to the ear, right? So here you can see elongated styloid process, right? So naturally when it is elongated, it will impinge upon the surrounding structures, right? And therefore it can cause throat pain, dysphagia, referred pain to the ear and referred pain to neck as well, right? It may also involve compression of the neurovascular structure nearby, particularly carotid artery. This is very important point, right? So one of the main structure which might get compromised because of this elongation of styloid process is our carotid artery, and second would be the cranial nerves, as we have already discussed previously. And compression of these vital structure mainly results in presence of any additional symptoms, right? So sometimes this additional symptoms itself gave a very important clue in many of the cases to aid in diagnosis of this Eagle syndrome, which include dizziness or presence of headache. Moving on further, let's discuss about the classification for Eagle syndrome. So based on the cause or the etiology, right, and the clinical presentation, Eagle syndrome is classified into two types. First one is the classic Eagle syndrome and another is the Stylocarotid syndrome. Now as the name indicates, the classic Eagle syndrome will include all the characteristic classical features or the general features which are associated with Eagle syndrome. Whereas as the name is indicating here, it is Stylocarotid syndrome. So definitely something is related to the compression of carotid here, right? Something related to compression of carotid artery is present over here, also known as vascular eagle syndrome. Why vascular? It is vascular because carotid artery, which is an important vascular structure, is getting compromised here, right? So this classification basically aids in diagnosis and treatment as well, and the management strategies for both of these cases are different. So it is necessary to classify Eagle syndrome. So in the upcoming slides in the clinical features, we will be discussing classical Eagle syndrome as well as the stylocarotid syndrome in detail. However, I have just added a few important points to give a clue about these two. Okay. So firstly, our classic Eagle syndrome occurs due to elongated styloid process or calcified styloid ligament. So this pathology will be same to both of them, right? So symptoms are typically associated with mechanical irritation or compression of the nearby tissues or the vital structures. And because of this compression, there are characteristic signs and symptoms, right? So first one is throat pain, then we have dysphagia, sensation of a foreign body in the throat, and referred pain either to the ear or jaw, right? So here you can see throat pain, then we might have dysphagia, presence of foreign body in the throat, and referred pain to the ear, or it may also be referred to the jawline as well, right? So in order to remember this, a simple mnemonic would be DART, right? You can just remember that. D for dysphagia, right? Then A for a sensation of foreign body, R for referred pain to ear and jaw as well, and T for we have our throat pain, right? Easy to remember, you just have to remember simple mnemonic, that is DART. Moving on towards stylocarotid syndrome, also known as vascular eagle syndrome, right? So again, same pathology, that is elongated styloid process, but here the additional thing is it is particularly irritating the carotid artery. It may be internal carotid or the external carotid artery which is getting irritated or compressed in this particular type of eagle syndrome. Okay, so the symptoms are basically related to the vascular structures, and also these are present because of the neurovascular complications, right? These are secondary to the compression. So the first symptom would be syncope or presence of any dizziness. Then we have headache, which might mimic migraines. Then facial pain and ischemic symptoms. Now these ischemic symptoms are directly because of compression of the internal carotid itself. As the blood flow to the brain is diminished, therefore there are ischemic symptoms. And also syncope, right? The underlying pathogenesis would be same, that is compression of the carotid artery will lead to dizziness as well as ischemic symptoms, right? So you can remember this by the mnemonic dizzy, heads, feel ill, right? So D for dizzy, we have dizziness, right? Same thing. For heads, we have our headache or migraine, right? Then F feels for we have our facial pain, and I for presence of ischemic symptoms. Easy to remember. So in some textbooks there are certain types of eagle syndrome which are mentioned apart from the classification. So I have just mentioned them here. Okay, simple in one or two lines we'll finish this topic, right? The first one is the classic type, right? So as the name itself indicates, it will have all the characteristic general features, right, in this type. So the classic type occurs after tonsillectomy resulting from the surgical exposure of the styloid process. Okay, so it is secondary to a surgery, so it might be regarded as a complication of tonsillectomy, right? The scar formation results in pressure on the nerve which causes pain while swallowing, like that is we have dysphagia over here, right? The next one is our carotid artery syndrome. It results from calcification of the styloid ligament as well as the elongated styloid process, which encroaches the internal carotid vessels and produce the characteristic vascular pain, right? So name itself indicates there is some problem with the carotid artery here, which is nothing but the compression of the carotid artery because of the elongated styloid process. Then the last one is the traumatic eagle syndrome, right? The word trauma, so here definitely a fracture element is present, right? Fracture is present, so it develops after fracture of mineralized styloid ligament, right? This is common in elderly population. Okay, so whenever the styloid ligament is already calcified, suppose, and there is any blunt trauma, then there is a direct fracture of the stellar process leading to traumatic eagle syndrome. Now let's move on to the clinical features, right? So first clinical feature would be on basis of age, right? So it is more commonly seen in adults, of which the traumatic type which we have seen, it is more common in elderly. Okay, very easy to remember. Traumatic, you can just remember it as a fracture of stellar process, therefore more common in elderly. Coming to the general signs, now these signs will be common for both classic eagle syndrome as well as the stylocarotid syndrome as well, right? So first is palpable and elongated stellar process. You can easily palpate the elongated process in stellar process in the patient, right? It may be felt intraorally, where near the tonsillar area during the examination. There is obviously pain upon palpation, right? There is tenderness or pain whenever you try to palpate the stellar process through the oral cavity. Then there is reduced jaw mobility or neck mobility, right? There is a discomfort or limited movements of the jaw and the neck as well. Now these all are happening because of the elongated stellar process. Moving on further, there is a characteristic sign which almost confirms the diagnosis of eagle syndrome, right? So before dwelling into that, just pay attention to this line. Patients with eagle syndrome will characteristically rotate their head slowly. Very important, right? So patients who have this particular disorder rotate their head slowly. Why? Because to avoid the pain, right? So what happens when the stellar process is elongated? It tends to compress upon the surrounding structures, right? And when the patient, if at all, rotates their head in a fast motion, what will happen is that there will be a sharp pain to the patient, right? So therefore these patients rotate their heads very slowly as compared to otherwise normal person, right? So this pain can be demonstrated, right? So it is a very important chair side maneuver which can be performed, right? This sign can be very easily elicited. So this pain can be demonstrated when pressing the pharyngeal wall against the stellar process. When the mouth is wide open, here you can see the clinician is doing the same thing. He is basically pressing the pharyngeal wall against the stellar process in order to elicitate the pain. Okay, and this chair side chair side test basically confirms the presence of eagle syndrome in majority of the cases. Moving on, let's discuss the signs of classic eagle syndrome in bit detail. Okay, so first is throat pain. Obviously we have seen this previously as well, and this is particularly pronounced during swallowing or speaking. Okay, second is otalgia or referred pain to the ear, right? And there is no underlying ear pathology present, still the patient will complain of ear pain, right? Sensation of foreign body in the throat, again the same reason, it is compressing upon the surrounding vital structures, right? So there is a constant feeling of something stuck in the throat. Then there is dysphagia, difficulty in swallowing because of again elongation of the stellar process, and there is a radiating pain, right? It might radiate to the lower jaw area or to the ear itself. Now let's discuss about signs of vascular eagle syndrome. So the most important sign here is the syncope or the dizziness, right? Which differentiates it from the classic eagle syndrome. Okay. So because here, as it is also referred to as stylocarotid syndrome, right? Here the carotid is involved. So because of compression of the carotid and the diminished blood flow to the brain, there are symptoms of dizziness and syncope as well, right? Compression of carotid artery. Then we have headache or migraine because of the vascular irritation, facial pain because of the compression of neurovascular bundles, and this also is referred to the face area. Then there are visual disturbances again because of reduced blood flow to the brain, and there is a pulsatile tinnitus, right? Previously we have seen in case of classic eagle syndrome there is otalgia, right? There is otalgia or ear pain. Here we have a pulsatile tinnitus. It is nothing but a sensation of hearing one's pulse into the ear. Now this is very characteristic and it is caused due to compression of carotid artery. Let's move on further towards the general symptoms. Okay, now these will be common for both classic as well as the stylocarotid syndrome. The first one is throat discomfort, then we have dysphagia and sensation of a foreign body lodged into the throat. These three are common for both of them. Moving on further towards the symptoms of classic variety. So here throat pain and neck pain. Especially this kind of pain radiates to the tongue, throat or jaw during activities such as talking, swallowing or yawning. Okay. Then we have otalgia without any apparent ear infection. Then clicking sensation especially during movement of the jaw or neck, right? Clicking or a snapping sensation. Then altered voice. This is due to irritation of nearby vascular bundle. Then facial pain, it might be of dull variety or sharp pain. Okay. Moving on further towards symptoms of vascular regal syndrome. First one is headache or migraine. Again because of irritation of carotid artery. Then dizziness because of the compromised blood flow to the brain. Syncope again because of the same reason. There is a pulsatile tinnitus. Very important point, right? Which is the feeling of hearing one's own heartbeat in the ear because of compression of internal carotid. Then presence of ischemic syndrome, ischemic symptoms, right? Now in very rare cases there might be a transient ischemic attack or a stroke like symptom may also occur. Let's discuss about the radiographic features, right? So here I have divided it on the basis of the different modalities of imaging which are available for Eagle syndrome, right? So first one we'll discuss the panoramic radiograph or the OPG, like what are the features which we will be able to appreciate on the OPG, right? So first one would be definitely the most obvious one, that is the elongated stellate process. Here you can see this is the elongated stellate process bilaterally, right here. So this one we have on the right side and of the left as well, right? This is the classic case of Eagle syndrome wherein you can appreciate the elongated stellate process bilaterally on the OPG, right? Then the length exceeds the 30 mm, right? When it exceeds 30 mm, it is considered as abnormal. Then it is seen as a long tiny bony projection which points downwards from the temporal bone, right here. Then calcification might also be present, right? And calcification of the styloid ligament is also very common. Then partial or complete calcification, again the same thing, right? It appears as a radio opaque structure. You can appreciate it here, it is a radio opaque structure. And calcification obviously will appear radio opaque on the panoramic radiograph. Second imaging modality would be LATCEPH or the lateral cephalometric radiograph. Now this is particularly useful for assessing the vertical extension, right, and the orientation of the stellate process. Now it shows elongated or an abnormally large angle stellate process. Here you can see, right? It is particularly important so that you can assess the vertical extension, right? And what it will show an elongation or an abnormal angle of the stellate process. Here you can see the elongated stellate process. Then we have another modality which is the CT scan, one of the most sophisticated modalities which is available, right? So yes, it provides detailed imaging, right? It provides a 3D view as well, right? So you can view the stellate process as well as the surrounding structures. It measures the exact length, angulation and the orientation of the stellate process as well. You can also get an idea about bone density. It can also identify the hyperdense areas of calcification in the stellate ligament. Now these things are very important when you are planning a surgery in these patients, right? You can also get a good view of the soft tissues, the surrounding tissues. Again, very important from the surgical point of view. It also helps you to evaluate the relationship of the stellate process with adjacent neurovascular structures, particularly the carotid artery. Therefore, CT is very important, particularly in cases of stylocarotid syndrome, right? You can clearly visualize the not only the stellate process, its length and the amount of calcification, but also if at all it is impinging upon the surrounding structures. So here you can see This is an image, right? You can see the elongated styloid process here, right? And this is the carotid, right? So this is your elongated styloid process over here. So again same thing here, you can see this is the elongated styloid process, and you can see how it is impinging upon the carotid artery, right? Causing a pseudo aneurysm, right? It is basically irritating the carotid artery or impinging upon it, leading to aneurysm. Here you can see the localized dilatation of the carotid, right? Because of this impingement of the styloid process onto the carotid artery. Let's discuss further upon the imaging modalities. The fifth one is the PA view or the anteroposterior view. It basically confirms the bilateral elongation or the asymmetry of the styloid process, right? So here you can see we have our AP view, and here you can see bilaterally enlarged or elongated styloid process. Right, here also you can appreciate the same thing, right? So based on all the 5 imaging modalities which we have discussed in detail previously, there are certain key features of imaging, right, which basically confirms the diagnosis of Eagle syndrome. First one is the elongation of styloid process greater than 30 mm, then angulated or distorted styloid process, calcified styloid ligament, and compression of adjacent structures, which is visible on CT or CBCT. Moving on towards the diagnosis. So there are two types of diagnosis here. First one would be the clinical diagnosis, and second is the radiological diagnosis. Now radiological diagnosis is very important tool, so you can relate your clinical findings with the radiological findings and arrive at the final diagnosis. So in clinical diagnosis, the characteristic signs and symptoms which we have discussed previously, right? So there will be pain in lateral pharyngeal wall. Then we have also discussed briefly about the presence of sign wherein we ask the patient to open the mouth wide, and when we are pressing the pharyngeal wall towards the stellar process, there is characteristic pain to the patient, right? Apart from it, blurred vision and ear pain will also be present. Radiological diagnosis, you can appreciate the elongated styloid process. You can also appreciate the calcified styloid ligament, right? So by correlating these two findings, you can easily make the diagnosis of Eagle syndrome. Moving on towards the treatment, right? So the treatment part is divided into 3 types. First one is the non-surgical management, then we have surgical management, and then post-surgical care, right? So under non-surgical management, we have medications. So as there is pain, the first medication which we will prescribe would definitely be analgesics. So NSAIDs are very popular, particularly brufen or acetaminophen or paracetamol is given for pain relief. Then corticosteroid, usually short courses are given to reduce the inflammation and the edema, right? Then muscle relaxant to elevate the muscle tension, particularly in the neck and jaw region. Then use of local anesthetics is also very common, right? So lignocaine injections are given for temporary pain relief. The next would be physical therapy. So neck and jaw exercises in order to improve the mobility and reduce the discomfort are suggested to the patient. Then there are certain postural correcting techniques as well, right? So these basically help to minimize the stress on the affected areas. Then certain dietary modifications such as avoidance of food which is very difficult to chew and soft diet is helpful, right? Then there are certain behavior modifications as well, right? So basically we suggest the patient to avoid the activities that can worsen the symptoms, such as excessive neck movements or clenching of the teeth. Now let's discuss further the treatment part under the surgical management. So the cases which do not respond appropriately to the non-surgical treatment, we ask the patient to undergo surgery, right? So it is indicated in severe cases or in presence of constant symptoms which do not respond effectively to conservative line of treatment, right? So our first surgical technique would be transoral styloidectomy, right? So basically we are removing the styloid process. styloid process, and ectomy means removal, right? So name itself indicates. The elongated styloid process is assessed and shortened through the oral cavity itself. What are the advantages? It is a minimally invasive procedure and there is no external scar formation. Disadvantages: as we are approaching through the oral cavity, the visibility is limited and there is a higher risk of infection. Other approach would be extraoral. So extraoral styloidectomy. The styloid process is accessed and shortened through incision in the neck. Right. So advantages is obviously there is better visibility. Then disadvantages, it will leave a scar mark on the neck. So in patients which are particularly concerned about the aesthetics and whenever possible, we naturally prefer transoral approach, and in cases where the access is difficult, then you have to go with the extraoral approach. So the patients who have undergone the surgical therapy, right? So there are certain post surgical care instructions which are to be given to the patient. So regarding pain management, analgesics are very important and they help to control the post operative pain. Then obviously we have to prevent infection, so antibiotics are prescribed in most of the cases. Then regular follow-ups are absolutely necessary to monitor the healing as well as to monitor the resolution of the symptoms. Moving on towards the last part, that is the prognosis, right? So with appropriate treatment, most patients experience significant relief from the symptoms, right? So whenever appropriate treatment is instilled, obviously there will be improvement, right? Recurrence is usually rare, right? Especially if the patient is undergoing the styloidectomy, so recurrence is extremely rare, right? So guys, that was all about Eagle syndrome. I hope you understood the topic very well. If you like this video, consider subscribing to my channel. I will be back with new video on a brand new topic very soon. Till then, this is Dr. Snehal signing off. Bye bye. Take care.